Good afternoon, everybody, and welcome to Shriners Hospitals for Children in Houston. My name is Tammy Robbins, and I'm here today with Dr. Alfred Mansour, who is heads up our sports medicine department clinic. What would you call it, Dr. Mansour?
I think it's our sports medicine program here at the Houston Shriners.
Great. Well, tell us a little bit about you. We'd like to learn, how you came to Shriners, what made you decide to become a doctor, why sports medicine? Tell us a few things about yourself.
Wow. So we might have to time lapse this to get through all those questions. But I mean, in a condensed form, I've loved taking care of patients, and then really fell in love with taking care of kids and found it as a vocation. And so it really hit a special place in my heart. And just the opportunity came about to be able to participate in Shriners in the aspect of sports medicine and hip preservation. Yeah. And for me, it just felt like another great opportunity to expand services there and to really create a program in a collaborative effort. And so just kind of step through that door. That was a few years ago, and now we're continuing to grow. We're part of a big multi-center sports consortium that's been an exciting growth opportunity for Shriners as an organization, but certainly also our Houston Shriners, just getting to highlight the kind of multidisciplinary approach to patient care that I really think is a special part of Shriners. And it's awesome to get to take care of patients that may not otherwise have a choice, and then some that have a choice and really believe in the Shriners way, and it's just fun to embrace that and carry that torch forward. So it's been an awesome opportunity.
This is great. So you've been with Shriners for a couple of years. Before we get into the consortium and we learn a little bit more about that, I just want to ask you a quick little fun question.
Yeah.
You've been with Shriners for a couple of years, and those of us who've been here for a while, it gets in our hearts and it has a special place for us. Tell us a little bit about how you've you're bonding with Shriners Hospital and what makes it special for you.
Yeah, so I love the mission of Shriners and that they're true to that mission. I think it has been in the Houston area a great place for patients to come that may, like I said, some of them seek it out. Yeah. As a great multi-specialty hospital that has a rehab, that has a gait lab, that have a bunch of tools that are somewhat unique in this area. And then also the patients who otherwise come from a pretty large catchment that may not have an opportunity to have care. And you just see it in the hearts and talking with all the people that are at Shriners. There's just a special attitude about getting to take care of those kids that I think makes it more than just clocking in, clocking out. These are all opportunities, and to have somebody say thanks when they may not get that opportunity elsewhere is a really big deal, especially in the perspective of our current climate and what's going on with the world. It's just awesome to be able to work for a purpose. And I think Shriners provides that to a lot of us, even in the sports world where, it's not maybe the most complex, rare of problems, but it's still an opportunity to help people that are in need.
I think that is probably for me, one of the great things about Shriners Hospitals is that, we have that level of care that anybody would want for their child, which is the best care possible. But we're also there for families who need us and don't have anywhere else to turn.
Right.
And then on top of it all, we have this sort of secret sauce, the love that's baked in a place where you and your child feel special and known,
Yeah.
as people rather than, just patients and numbers that come in through the door.
Yeah, it's fulfilling on so many levels, which I think is what makes it just a great place, great for patients. And it's just when you receive as you're giving, as a surgeon, it's kind of a double win. So yeah. It's been great.
Good deal. So tell us, let's get to sports injuries. If we got some moms, out there who are watching this, what kind of sports injuries can we come to Shriners in Houston for?
We really take care of the full gamut. I mean, outside of head injuries in our specific clinic, we will deal with throwing injuries, fractures, lots of knee injuries, ankle, certainly a full gamut of hip preservation. I think we're seeing a lot of throwing injuries as people are getting back online with some of their activities. So I think there's been a little bit of an uptick with that, just because that's something that if you take off in the season, which I think, the COVID situation has been a pause button for a lot of people. I think that especially if you're a kid, you hit pause and then you think you can just hit play again. And so we've really almost, you can time when people are getting back in, because you can see the injury incidents carry back up. And I think it's particularly true in the throwing injuries, because we see kids who haven't really thrown in 3 or 4 or 5 months, and they don't realize that that's longer than they didn't throw in the off season. And so they just come right back up to, hey, we've got a tournament this weekend. Can I participate? Sure. All of a sudden they're pitching again as if they pitched last weekend, but last weekend was really, the end of February, early March, and now we're in July and August. And so I think just educating families on coming back online, really have to think about, you had a 6-month time where you were out of your sport. And that's the same thing with all the overuse injuries. We can see it in running. We see it in soccer players. Basically any sport that you need to preseason condition for, you have to think of this kind of shutdown time as off season.
Okay.
And if you haven't been training and preparing in the off season, you can't just pick back up as if you paused and hit the play button. I tell people they can't get back into it like they're on a rocket ship, just straight up. They have to go in on a steady incline to avoid those injuries.
That's hard to do, and hard to remind yourself that you have to do, especially when you love a sport so much, and you're ready to get out and throw a baseball again, or throw a football, or even play soccer. You're just ready to go out there and go full tilt, and because you love it so much.
For sure. I mean, I think everybody has good intentions. You have to remember that kids can fall into that weekend warrior status that so many of us adults know exactly what that means. Most kids have not had a 5 or 6 month period where they've been stuck in a house or haven't done anything outside. The working adult world, we know that. And we go try to play a weekend of basketball, and all of a sudden we're hurting for 2 and 3 weeks because we don't do that. But kids, to a different degree, are still susceptible to that. If they have a long course where they're out of conditioning for that particular sport, it doesn't work that differently. So I think we just, as parents and coaches, we just have to be mindful. We cannot fast forward the preparatory phase of the return. We have to push back whatever event we're trying to train for, or we have to start the clock earlier. But if we're forced in a shift where that preparatory phase is pushed forward, you can't squish it toward the end goal. You have to keep the same amount of preparatory phase and just move the goal where you're in shape, or whatever your max allowed is going to be. You have to push that forward in the same, keeping that same interval, if that makes sense.
Yeah. We live in a society where we want things immediately. And I'm ready to do this now.
I'm ready yesterday.
So I had some questions on here, but I would love to hear more about, your team that you have there in Houston, and how you all work together for the best of children who have sports injuries.
Yeah, I think, one of the really unique aspects of the Shriners Hospital system is the model that they get to work in with the collaborative, multidisciplinary teams that actually, for our sports clinic, for instance, we have a physical therapist that's in the clinic and actually helping to assess the patient at the same time that I assess the patient. We're bringing online our gait lab functionality regarding sports, which is a really exciting aspect. And I think that
explain to people what a gait lab is, because I think for those of us who have been around Shriners, we know. So
so a gait lab is basically, I say gait lab, but it's really a lot more than that. I don't want to oversimplify it. It's really a motion analysis lab. And so using reflective markers, cameras at different angles, something called force plates that can see how much force you're generating when you land. Really taking that and applying it to the sports world is something that can really push us ahead of what of my understanding of injury patterns and hopefully prevention. I mean, really our goal is to prevent these injuries. And I do think the emotion analysis aspect of it has huge potential to really bring us into that, because what I can see as a single surgeon evaluation of a one-time event can be dissected and understood at such a different level whenever it's videoed and recorded, and you can see how joint movement and joint reactive forces on a much more scientific level. So I think our ability to treat the patient on that level really is something unique to Shriners, and is really appealing for me as a sports surgeon to be able to offer that.
I think that's appealing to parents as well. I mean,
For
just
sure.
to have that, that whole team approach and holistic approach to it. I have a question for you that came from one of our Facebook fans, and that is the difference between a sprain, a strain, and a tear in athletic injuries.
Okay, yeah. All right, hopefully I won't get them confused, right? So usually it's strain the muscle. So tends to be muscle-based, sprain the ligaments, which would be connecting bone to bone. And then tear, you can tear a ligament, you can tear a muscle. So either one can have a tear. Usually we try to grade them on the severity. So if you wanted to kind of look at it and say partial tear, complete tear, some of that's interchangeable with severe sprain, severe strain versus mild sprain, mild strain. It's a way for us to communicate, but I don't know that it's that imperative to separate the two. It's more of, and I think people probably get them mixed up all the time. But if you're really describing, is it a sprained ankle? Yeah. So you're saying sprain the ligaments in the ankle versus a hamstring strain where you strain the muscle. So I think identifying the injured part is probably a little bit more important than whether you got the difference between the two.
Gotcha.
But pretty common in all of these returns, especially if kids don't stop growing during a pandemic. And so if they're not exercising and stretching and doing their normal activities, a lot of them are just getting tighter. Yeah. And so their growth still continues, but maybe their flexibility program is on hold, or they've changed, pivoted and shifted to different activities. And so we do recognize that if you lose flexibility, you're probably more likely to have a muscle strain. And so I think that's something that maybe there's a peaked interest, because you're probably going to see a few more of those than you typically did in these kind of continued seasons where the kids were able to keep up with that, their growth.
Gotcha. Good to know. So what are the repercussions that you have seen from overlooking injuries or playing through the pain?
I think, you hate to see them. And I think fortunately our access to care is good overall as a city, as a region. And so I think we see fewer and fewer neglected injuries. The ones that really get us, I think, really are the throwers, so the throwing athletes. So going back to that, I think there's kids that have medial or inner-sided elbow pain. Mm-hmm. I tell them you don't want to throw through that. Kids that can have joint-related symptoms and think that it's really muscle soreness. I think that's where we get into trouble. Or they have hip or knee pain that's really a hip condition. One in particular would be called a slipped capital femoral epiphysis, which actually is a growth plate problem, but it can present as this kind of vague knee pain. And we've seen it just delay in diagnosis just because it kind of trick us. It presents as a knee pain. I have knee pain, my knee hurts, they're pointing to their knee, but it's really a hip problem. Really? And so they're sometimes sent to physical therapy. Some kids have even been operated on in their knee, thinking that it was the knee as the culprit, and then come to find out it's the hip. And that can lead to, pretty significant problems later. And then in the throwing athlete can lead to some serious problems that may even prevent throwing later if it involves the cartilage, or if it disrupts where the bone attaches to the ligament. And certainly in the younger kids, I try to just counsel families, you don't want to be a flash in the pan. It doesn't matter if you were the world's best 11-year-old. If you don't have longevity in your athletics and don't peak at the right time, then you're really not going to be having a durable career, which typically is what the parents and the kids are trying to do. right? Make it to the next level, collegiate, professional, whatever that is. But peaking at 11 and then going overboard down into the injury prone overuse, quadrant, it really just, it creates burnout and then just disinterest in activities. And
Right.
Ultimately all that time becomes, time that doesn't propel you forward.
Right. And at the root of it, sports should be fun.
Yes.
Especially when
Yep.
you're in youth sports. You should
Yeah.
make
And
a
that's
good time.
absolutely. And that's what I tell my son, who's right now very involved in basketball and working hard, and just tell him, I want you to make sure this is fun. You're doing something at a high level and working really hard. And the whole point of this is for your enjoyment. And so if you're turning this into a job, take a break, because you're not going to have the durability. You're not going to make it across that finish line if you don't have a passion for it that is because you're enjoying what you're doing. So I think
And that's
keeping a
a
healthy
lesson for
perspective
us for
is
the rest of our
important.
lives too, right?
Yeah, for sure. Yes, absolutely.
Yeah. So tell me, maybe what I haven't asked you about your sports medicine program there at the Houston Shriners Hospital that you want to make sure that people know and understand about your program. If there are people that you want to give a shout out to who are on the team, or
Yeah, I think that probably the coolest thing and the most important part is that it is a team. I mean, the sports team is no different than your kid's all-star team. It's a bunch of people with this shared vision, trying to do their best to make a difference in whatever they're doing. If it's the athletic competition, in our case, it's the care of kids that have sports-related injuries. And we have some exciting things that we can do through Shriners because of their mission, because of their values, because of their multi-hospital system. One that I mentioned earlier is our sports medicine consortium, and that is really where we're bringing online some of the unique offerings of Shriners, mainly the GATE, the Emotion Analysis Center, and kind of the exciting, hopefully preventative aspect of that, and just getting families to understand that we may be looking at pretty slick ways to analyze body position and muscle adaptation and biomechanics to hopefully decrease the injuries. I mean, I'm a surgeon. I take care of a lot of problems once they happen, but really having Shriners trying to commit to the prevention of these injuries is it's a huge investment to hopefully put yourself out of the surgical business. I mean, you really are just saying, how do we not get that ACL tear? How do we not have that patellar tendon injury? I think the Shriners hospitals are trying to lead that through a multidisciplinary approach, which is really exciting, because I think it really is, it's about the patient, and it's about the kids, and it's about the journey. And there's a great team. It's not one face. I happen to be the surgical face for it, but there's so many people that are involved in taking care of it. I think that if families understand all the touch points, from the person checking them in, from the person, the medical assistant that may be providing the initial screening for them, everybody is on that team for that patient's journey. And that's what makes it an exciting process.
Well, I think that's a perfect way to end it. Thank you for joining us on this interview today and sharing your knowledge with our Facebook fans and our social media fans throughout the country and throughout Texas. So
awesome. Thank you very much. Thanks for having me. Really
thank you very
appreciate
much.
it.
And folks, if you have more questions about our sports medicine program at Houston Shriners Hospital, or if you'd like to make an appointment or even contribute to Shriners Hospitals for Children, check out our information in the comments. And we're glad you joined us today. Thank you very much.